guys, welcome back to my channel. This is the channel where I share my journey of becoming a neuropsychologist. I just came out of a class and I'm going to Mr. Price Sport to go look for weights because I don't want to renew my gym membership. So I'm just going to go look for weights. But I just came out of such an interesting first class. So this was my first class of neuropsychological rehabilitation. And my fear is I'm going to forget some of the interesting things that were said in class. So that's why I'm recording while I'm driving. So I am really hoping that this phone is recording, because if this phone is not recording, angaz for real. Like angaz for real. I don't even know if it's illegal. Let me do this. But it looks like it's illegal. It looks like it's very symmetrical. Symmetrical. So in our class today, our lecturer kept saying, if you don't do it, then who will? That statement hit me hard. I'm not gonna lie, that statement tugged at my heart so badly. So I'm actually gonna park quickly because I want to read something that's on the HPCSA website. I'll read it just now. But when our lecturer was saying, if you don't do it, then who will? So he was speaking to us about future neuropsychologists, and he was saying to us that as neuropsychologists, you're going to be dealing with patients that have neurological disorders that have emotional impacts that has changed a person's personality. And if you are just going to then say, if you are not going to provide like psychotherapy to those patients, then who will? Because a neurologist knows the neurological damage or the neurological side effects or dysfunctions and defects that come with the condition, right? But they don't know, or they don't deal with the psychological condition that comes with the effect. This phone, I feel like this phone is moving, guys. I'm so sorry. But they don't deal with the psychotherapy. They don't provide psychotherapy. They don't deal with the psychological conditions that come with that condition that you're dealing with, right? And then there's the clinical psychologist. Clinical psychologists, they know the psychological conditions. They know personality changes. They know guilt. They know shame. They know all of that. But they don't know how to tie it back to neurological conditions, because they don't know the neurological mechanism of the brain. And we are getting training because our course is clinical neuropsychology. So we are getting clinical training, or well, he insisted that if you're going to do this type of rehabilitation, then you're going to need further training after our 3 years, or in your third year you need like another level of training, in that you're almost trained like a clinical psychologist. You're trained to provide psychotherapy, but you're trained to provide psychotherapy for patients that have central nervous system conditions. So for instance, if someone has been in a car accident and they hit their brain so much, they've experienced a TBI, a traumatic brain injury, and that person's personality is gone. That person's life, the way they know it, is gone. In that, let's say the person used to be a doctor, and now they can't return to work. Their life has completely been changed. They used to be this big shot, they used to be king, man. They used to be, the world was their oyster. And is it oyster? The world is your oyster. I think that's it. But the world was theirs. And then now life has changed for them. Now their brain has a defect. They can't go back to work. They feel like a burden on their family. Their family feels guilty that this person feels like they are a burden on them, but also their family feels guilty. Yes, actually this person is a burden on us now, because this person can't feed themselves anymore, or this person can't go back to work. Maybe their case is not that bad, where they can't move, they can't talk, but the person is moving, the person is ukona, the person ukona, but they can't go back to work, they can't hold conversations the way they used to, they can't provide for themselves the way they used to. Who's taking care of those patients, you know, when someone suffers a stroke? Because also, it's not enough that a doctor looks at you and says this part of your brain is damaged and that's it. Like, it's not enough, you know. Where to from here? Who provides the where to from here for these patients? And then akuna parking lana, guys, that side. Oh, thank you. Sorry, I thought there's no parking, so I started losing my mind. I actually didn't realize there were 2 gates. Yeah, nice life problems this. I'm actually going to park here and finish recording this video and then get inside and go look for my weight. So yeah, who's treating those patients? Who's taking care of those patients? You know, he provided such amazing examples in that if someone is born without a certain part of their brain, maybe let's say you don't have your amygdala, or your amygdala is now damaged and it needed to be removed. What does life look like for you after that? You need someone that's going to work with you, that knows neuropsychology, that knows neurological conditions, neurological disorders, but also understands psychotherapy, also understands therapy, also understands people, also understands emotions, also understands personalities, also understands human behavior. You know, that there's a lot of neurologists that are just like, there's the body and there's the mind. You know, it's 2 different things. If you're and then they treat neurological conditions like it's just a body problem, like it's just your body is broken, but you can move on with your life. Yeah, you can move on with your life. I need to check if this thing is recording. Oh. Yeah, they treat your condition like your body is broken, which is your brain in this instance, like a part of your body is broken and there's nothing we can do about it, and bye-bye. But your body is broken, that's going to affect your personality in some way, that's going to affect your sense of self, your self-esteem, your life as a whole, you know, how you think about yourself, how you relate to the world at large, you know. Then who helps you in that instance? Like, who helps you in the instance where you are paralyzed, but you don't think you're paralyzed? Like, there's conditions like that where the individual does not think they are paralyzed. They are not aware that they are paralyzed. Who intervenes in those situations? Who then, like, there's conditions that directly affects, there's neurological conditions that directly affect your emotions, you know, and clinical psychologists understand the emotions, or the psychological part of it, but they don't understand that you are behaving like this because there's this part of your brain that is physically, like, it has physical defects. We can see it. We can do an EEG, we can do an fMRI, and we can scan your brain and we can see it. No, this person's amygdala is damaged, this person's hippocampus has shrunk, you know. But like, clinical psychologists don't get exposed to that part. They don't get exposed to brain scans, they don't get exposed to neuroimaging, they don't get exposed to neuropathologies, you know. So then who helps those patients? Like, who is in charge of when he kept saying, if you don't help them, who will? Because no one else will help those people, no one else will intervene. That hit me so hard. He was like, when someone has suffered a stroke and there's no going back to work, there's no going back to normal, who is the person that's going to say to them, neurologically, this is what has happened to you, psychologically, this is what you're experiencing psychologically, and that's how it ties back to your neurological condition, and this is how we move on from here. And that's where the rehabilitation part comes, in that, because he said there are two types of, did he say 2 or 3, I don't remember well, types of neuropsychological rehabilitation, in that the one rehab part of it tries to almost like repair your brain, using things like what is it, neuroplasticity, taking advantage of neuroplasticity. If your memory is damaged, we try and heal you almost to, because most of the time your brain can't go completely back to normal, but there's some level of normalcy that you can get back, so there's that part of rehab that either works with memory, attention, or executive function, in that we have certain interventions to help you navigate that. For instance, there's people who, after having whatever condition they have no memory. Like, they have no memory so bad that they can't remember how to make coffee, then there's a lot of apps now that have been created where in the app, as a neuropsychologist dealing with a patient like that, you map out their intervention for them, and in their intervention, let's say maybe one of the things that you're going to be using is this app, and this app will say to them at different times of the day, like it will be detailed, at different times of the day, you say, the app will remind the person, it's time for them to make coffee. But even in the making coffee, because they can't remember how to make coffee, every step of the way needs to be detailed. Maybe, Endlin, you have posted stamps where next to iketlela you say, put water in the kettle and actually plug it. Because if someone has, guys, we need to appreciate our memories. We need to appreciate our brains. If your brain is working fine, you don't think that there's someone out there that needs to be reminded that if you're making coffee, you actually have to boil the water. Because if you're going to put a posted note there and say to them that fill iketlela, they're going to fill that kettle, but they won't plug it. You need to say boil this water. So that posted stamp needs to say fill and boil, or fill and plug, fill and switch on, right? Then there's a posted note that tells them go to make coffee and whatnot. And this is hoping that after a few months, the brain will use, I don't even know what the terminology is, but I'm in my first year of masters. So come back to me at year 3 and I will give you these terms. But we're hoping that the brain, if the brain uses, let's say the brain uses this part, right, to remember all these things, and that's the part that's damaged. Now we are hoping that your brain will use the other parts of your brain that is not damaged. There is a term for it, man. Oh yeah, your brain will use the other part of your brain to now remember these functions that we're now, it's almost like we're re-teaching you. And the different parts of your brain will now remember these things. And after a few months or a few years, your brain will now remember, good to know, when I'm making coffee, I need to feel get like and then boil and. But it's a lot of work. It takes a while. Working with these patients requires a lot of patience. So there's that part of rehab. There's that intervention based type of rehabilitation where it works with different kinds of rehabilitation. Then there's a type of rehabilitation that in this patient where it's like psychotherapy type of neuropsychological rehabilitation. This patient will never come back to themselves. Either that part of their brain is completely gone, it doesn't exist, because there's people that are born without a cortex. If you're born without a cortex, and we are like, that is the part of your brain that does executive functioning, that does high level processing, and what do we do with you? How do we support you? Like Aiko, there's no, we can teach you, and then this part, no, there's that part of your, there's like, it's not even a damage, it's gone. Aiko, what do we do? You know, how do we support you and your family? Basically, the type of neuropsychological rehabilitation that I'm talking about, my lecturer spoke about today, was rehabilitating or assisting person from a place of how does it feel to have this condition? Like, how do you feel emotionally now that you have this condition? And how do we support you or rehabilitate you when you have this condition? You know, sometimes your neuropsychological condition, your neurological disorder maybe causes paranoia. And because you are surrounded by people that don't understand, that they can actually explain to you that because of this condition that you have, you're going to experience paranoia. And what you're currently doing, these symptoms are showing us that you already have paranoia. I need to move the camera where I placed it because it's going to start overheating soon. Oh. Okay, let me wrap it up quickly, because I did say I was wrapping it up. We have this patient, they have this neurological condition. This neurological condition is causing them to be very paranoid. You educate, as a neuropsychologist who is working with rehabilitation on this patient, you educate them on what the condition that they have. You walk out this journey with them to let them express exactly how they are feeling, right? Then you connect what they are feeling to the neurological disorder that they have, and then provide intervention for them, where the intervention is maybe teaching them that when these emotions arise, as much as a psychotherapist, let's say, oh, sorry if I trigger anyone with this word, like rape. If someone has experienced rape before, and a psychotherapist walks out this journey with you and unpacking this rape incident and whatnot, and then they tell you that in some instances, when you are about to be physical, intimate with your partner, and that part of your brain remembers the incident, remembers the rape, you can literally breathe out, you can calm yourself down and tell yourself that I am safe now. Yes, that thing happened, but this that is happening now, I like it, I enjoy it, I want to be, so that your brain doesn't go into fight or fright, fight or flight. So you can calm yourself down like that. It's the same with the person that has the neurological condition, in that you then teach them that when you start feeling like this, when you start having these when you start experiencing this paranoia, you can actually bring yourself towards yourself and say, no, Konje, I have this condition, and yes, it presents like this, and nothing is happening, like whatever. If you feel like the building's about to fall on you, these are just worst. These are things that are just coming out of my mind. It's not anywhere in any textbook. It's not it's just me coming up with random nonsense in my mind. Your paranoia says this building is going to fall on you now. I don't know any neuropsychological. I don't know any neurological disorders right now, and I don't know if any of them actually present like that. But let's say there is one out there that presents like that. Then you can actually tell your mind that no, it's because of this condition that I have that I'm seeing this big building about being gonna to falling on me. And then you can hoosa, and then I don't know if you can hoosa or whatever, but you teach your patient about what's actually happening with them. But in this situation, we're not talking about people that are just suffering from depression and maybe it's like just life experience or whatever. We're talking about someone that is experiencing deep depression purely because of their neurological disorder that they experienced. And I need to be able to know this central nervous system condition, which part of the brain is injured or has a defect. How does the mental disorder manifest? I'll say manifest for now. What is the mental disorder that I am expecting because of this person's condition, and how do we help them through it? How do I combine the field of neurology and psychology to help this patient that is experiencing symptoms and experiencing symptoms and signs from both neurology and psychology? And how do I help? So yeah, that was my class. That was my class from today. I wanted to read something from the HPCSA website, but my phone is really going to start overheating. So let me go look for these weights. Actually, let's go look for the weights, and then when I get home, when I wrap up this this vlog, I will read what the HPCSA says about rehab and neuropsychologists, and what neuropsychologists are expected to know when it comes to rehab. I hope you guys can see me, because if I'm sitting against the sun, then I'm very dark and you guys won't be able to see me. But you guys understand what happened. I didn't know where I parked. I can't see it. So let's go look for my weights. I genuinely like vlogging. I like vlogging. I don't know why I don't do it more often, but I genuinely like vlogging. Anyway, that was my shopping for my weights. I was there for less than 15 minutes. I'm one of those people that don't like shopping. I don't like shopping. When I go to a mall, I go there with a mandate. I'm in and I'm out. I genuinely don't like shopping. I don't like shopping for clothes. I don't like shopping for... I just don't like shopping. Groceries are a bit better than clothes, but shopping for clothes just takes me out. It proper takes me out. I really don't like it. So yeah, which is very different to like my mom, my sisters, a lot of people. They take it in, they go to a mall, they move from one shop to another. I go in there, first shop in J, I'm like, Sambanin la Sambanin, I don't want to be here. So now I'm going home. I'm not going to continue recording because I think I'm done with talking about my class. I think I've said what I needed to say about class. I did say I was going to record and say what the HPCSA says about neuropsychology, and I think I'm gonna close this. HPCSA neuropsychology. I want to close this vlog, so let me open it now and tell you what they say. I genuinely like vlogging, guys. It makes me feel creative, man. Okay, so when you go to Google and you type HPCSA neuropsychology, there's a document that pops up. It says guidelines to prepare for the national board examination for neuropsychology. So it's guidelines for that, and then it tells you everything else. It will give you the scope of the exam, and then it will give you neuropsychological assessment, neuropsychological interventions, professional practice, ethics, legislation, all of that, basically telling you what a neuropsychologist should do and what they shouldn't do. So when it comes to training, it says treat and rehabilitate the neuropsychological disorder of people suffering from CNS, which is central nervous system dysfunction. So let me read that again. Treat and rehabilitate the psychological disorders of people suffering from CNS dysfunction. So we are treating psychological disorders of people suffering from central nervous system disorders when it comes to the treatment and the rehabilitation, which is a bit vague, because one could say if we're talking about nervous system, we're talking about everything that is brain related, and then but we all know when they say nervous system, they mean neurological dysfunctions. So we are treating the psychological rehabilitation. We're providing psychological rehabilitation, neuropsychological rehabilitation for psychological disorders pertaining to neurological dysfunctions. Does that make sense? I hope that makes sense. I'm not going to say it again because it sounds like a tongue twister. But yeah, basically we're providing support, treatment and rehabilitation for psychological disorders for patients that have suffered some sort of neurological disorder. So I wanted to read that because I'm like, it's in the HPCSA, guys. It's in the HPCSA, HPCSA and stuff. Dr. Matthew Lani and stuff. Thank you so much, guys, for watching. Please like, please share, please subscribe. Like I said, this is my journey of becoming a neuropsychologist. I actually need to do a proper sit-down video where I tell my story from undergrad, how I got here, because I said in my first video that I did my undergrad in accounting, then went to go work, then did personal training, opened a business in that, and then did my undergrad in psychology at UNISA, did my honors in psychology at UCT, and now I'm doing my master's in neuropsychology at UCT. But that's a video for another day. Thank you so much for watching. Bye.